you, Celine. Let me just tell once more about Celine. Celine has 7 years of experience in Oman. She has cleared her OET in the first attempt, and we are really proud to have you with us, Celine. We welcome you on behalf of Edu Skills family from our mentor and all of us. Thank you so much for being with us. Over to you, Celine.
Thank you, Jenny. A very good morning to all who are in this platform. And I would like to thank Father Saleen Joseph. He has given me such a wonderful opportunity to share the knowledge, share something which I have gone through and I learned from. I learned during the journey of this OET training. Already Jenny has told regarding this Edu Skill platform, so I'm not going in detail, but uh, it's a profit-free platform. You have to utilize it because you're getting so many materials and so many educational videos at free cost, and you can utilize those things so that you will be getting more information, so that you will be getting a good path to achieve your dream, that is OT. So you can pursue some jobs in the European country. So before starting the session, I would like to give, I think you can see my PPT. That's
Yes.
speaking subject, how to do an introduction in a different setting. So I know that you're doing the speaking session on a regular basis, so you will be familiar with all the settings. I'm just giving a brief idea regarding how to introduce. Okay, so initially we will be going through what is this speaking test. It's an overview. So I know all of you know this because you have seen same slides in Father's PPT also. So there will be an examiner, so or the interviewer. We will be call him as interlocutor, and the duration of the total speaking session will be 15 to 20 minutes. And the procedure is like there are mainly two sessions. First one is the warm up session, and second one is the role play, the real examination thing. And the role play, there are mainly two role plays for each candidate, and for each role play they will be taking 5 minutes for each one. And regarding the structure, we will be starting the interview. As you all know that after starting the interview, we'll be taking the history of the patient. We'll be just briefly introduce our setting regarding what is the purpose of this visit or something, or what is the purpose of a visit on, or if it is a community health center, we'll be asking what is the purpose of their visit in the community health center, and we will be taking the history from the patient. That's the second part. And we'll be explaining the task. The task will be different. Sometimes we'll be explaining regarding the medical condition, sometimes regarding the procedure, sometimes we'll be alleviating the concern of the patient. And during the whole role play session, we have to provide reassurance for the patient and also educate the patient regarding if patient is having any misbelief or any misunderstanding regarding the condition, or if the patient is having any anxiety related to any procedure. We will be providing education and reassurance, and we will be ending the interview. This is the whole structure of a role play. During this role play, we have to have mainly two things. That is, first one is whatever it is, you are going to see that role play card for the first time, because you have practiced so many role play cards, but at that point of view, will be getting a new role play card, which you might not be familiar with it. So you have to be confident and go with a proper organization that will be providing a good structure for your role play. And always when you are starting your role play, you know that in a hospital setting also, when we are interacting with the patient, we will be building a rapport and a trust from the nurse, right? If we are a patient. So if you are a nurse, also we will be building a rapport with the patient, and also we'll be gaining trust of that patient, so that the communication will be easier. Likewise, in the role play also, we have to gain some we have to inform the interviewer that not through the verbal, through our confidence, through our posture, through our facial expression, we should inform the examiner that we are pretty much confident in this role play card and we are going to win this. So you have to have some confidence so that you can go through the task in a proper way. Okay, so that is the role play structure and the basic skills that you need to have to do this role play. That first one, you have to introduce yourself and open the conversation. And whenever you are dealing with the patient, initially there are mainly two types of questioning methods that are we can use open-ended questions and also closed-ended questions. Whenever you are starting the conversation, we'll be just taking some closed-ended questions and then we will be going into the open-ended questions so that we can encourage the patients to speak out. Okay. Then whenever we are doing this role play card, in the real scenario also we know that if we are only talking, if we are not providing enough time for the patient to talk, the conversation will not be that much good. They will be getting bored or sometimes they will lose the track of that conversation. So always allocate the time for the interviewer and also for you to talk as much as you have to talk, but we should provide some gaps or pauses so that the interviewer can also interact with us. That will be the better speaking session. And at the end or in between, you can summarize the points that you have told, or sometimes you can restate. Sometimes the patient will be telling some worries, so we can just restate. So you are telling that you are anxious regarding this procedure. Is that right? Like that, you can just restate that that communication or that sentence, so that they will be thinking that we are on that track of communication. Then encourage the patient to change or to do something like that in topics like smoking cessation, alcoholic patients. So we are providing some rehabilitation care or something. In that case, we are encouraging the client. So in that situation, we have to use some positive reinforcement, some positive statements or phrases, so that the patient will be having some information regarding this topic, that is rehabilitation or something. So he will be coming into our way of communication, like he'll be knowing more information regarding this rehabilitation and he will be changing that. It's We are just enacting, but we'll be acting like it's in a real scenario. Then empathizing, if the patient is in difficult situation or in an aggressive mood, so we have to use more empathizing words and reinforcing words so that the communication will be in a proper way. You have to think on OET role play card basis. Okay. As questioning technique, already you might be gone through the video further on how to start a communication or how to ask questions with the patient. So if you have gone through this, you might be knowing regarding these questions. There are mainly two types of questions, questioning techniques, that is open-ended question and closed-ended question. So in an open-ended question, we'll be directly asking that yes or no type of question, that is a yes or no question, that is a closed-ended question. So we'll be asking where you are having any pain, or where is your pain, are you having pain, are you taking any medication, are you married. These all are closed-ended questions. In these questions, the patient will be giving the answer in a yes or no manner. That is a closed-ended question. Sometimes we have to use this closed-ended questions because we don't want to get more information, because we need to complete all the tasks. That time we can use this closed-ended questions. And the another type of question is the open-ended question. In that, we are providing some time for the patient to briefly describe regarding their condition. The questions like, tell me about your pain. In that time, the patient can briefly describe regarding he's having pain on this area and when it was started and when it is aggravating, like that he can tell. Which medications did you take at home? If he is taking so many medications, he can describe regarding all the medications. That is open-ended question technique, and tell me more about your family. So there is, we are giving some freedom for the patient to give more information. That is a technique. So I hope you understood. So we just told regarding the technique, questioning technique. That is mainly two type of questioning technique: closed-ended questions and open-ended questions. Whenever we are starting the session, we'll be just asking the closed-ended, and through the pathway we will be just asking with the open-ended questions, so that we will be getting more information regarding the patient. And there are mainly two types of language or questioning language. There are direct or indirect. Direct questioning technique is like, we are directly asking the patient regarding the information. Can you tell me? Would you mind telling me? May I ask related to something? Or please tell me regarding your lifestyle. Or let me ask you regarding your medication pattern. Like that. These all are the direct type of questioning technique. And there is another way, because if the situations like, if you want to ask some private, uh, uh, some questions that is related to his personal thing, like, are you smoking? We can directly ask the patient that, are you smoking, or like that. So in that case, we can use some direct way of asking the question. That is, if you don't mind, I would like to ask some questions that is related to your general health. So like that we can ask, or sometimes we can ask, I'm afraid I need to ask some personal questions, may I proceed? Like that we can ask. So it will be a polite way to ask something which is personal to the patient. So we just dealt with the topic, like, what is the questioning technique. So mainly two type, that is open-ended question and closed-ended question. And another type is direct way of asking the question, or indirect, using the indirect language to ask the question. So I hope you understood. I'm not too fast, I think. So this is our main topic, that is the common setting in an OET role play. Till this topic, I think you understood, right? Is there any doubt? I think at the end of this session, we will be having a discussion session. During that time, you can just ask the questions which you have, but just jot down in your paper which you have, so that at the end you will be remembering the question and you can ask it. Okay. So next, we will be going to the main topic, that is common settings in a OET role play. So main settings in this role play card will be community health center, private clinic, hospital wards, outpatient department, home visit, school, procedure room, nurse practitioner, maybe they're dealing with a nurse practitioner, maybe in a clinic or something, then emergency department, or sometimes there will be a setting like recovery room. So these all are the settings for a role play card. So somebody will be thinking that most of the persons will be using same way of talking with the interviewer for the same for the different settings also. Like if it is in a community center or a hospital ward, there will be a different type of, or there is a different technique to tackle with the, or to introduce with the interviewer. So I'll just briefly go through each setting, and so that you will be getting more information regarding how to start an interview, or how to start a role play in different settings. Okay. So first we will be dealing with the hospital ward. So in a hospital ward, there are mainly two types. Like sometimes the patient might be a known case, sometimes it might be an unknown case. So in each type of case, we will be introducing in different manner. So in an unknown case, we are not aware about the patient details. We don't know who is at front of you. So in that setting, we have to first greet and self-introduce. Like, Good morning. I am Saleen Antony, one of the registered nurses working in this hospital. Like that, you can just greet and self-introduce yourself. And we can just start the conversation like, for my verification, or sometimes you can use for the confirmation or for the documentation purpose, could you please tell me your name? The verification, confirmation, documentation, we are not using at the same time. Different time we'll be using different, all the, they are like synonyms. In one role play, you can use like for my verification. You are having two different role play cards. So in next time you can use like just for the confirmation, I would like to ask your name, or could you please tell me your name? Like that you can ask. That is usually used in a unknown case. For a non case, before starting the role play itself, you have to ask the interlocutor regarding the name of that patient. And we can just introduce like, good morning, Mr. Joseph. I'm Celine Antony. I'll be your attending nurse today. Like that, we can just start in a hospital ward setting. This will be the introduction for a hospital ward. Okay. In another scenario, like if it is in community health center or in an OPD or in a clinic, we'll be using a different way of introduction. Like if it is in this also, we are having some unknown cases and known cases. If it is an unknown case, we'll be starting with a greeting like, good morning, please be seated. Or you can say like, please take your seat. And we can just introduce like, I'm Saleen Antony, the community health nurse working in this community. Or you can like start like a registered nurses working in this community health center. Better to use different way in different setting. Okay. And for my documentation purpose, may I know your name, please? And we have to ask the purpose of their visit, because if it is in a hospital setting, from the records or from the patient itself, we can identify why the patient is admitted in the hospital, so we can get that information. So but in a community health center, the patient is coming towards you, and the patient might be having some issues. So first we need to identify what is the purpose of their visit. So we can just ask like, what brings you here today? Or may I know the purpose of your visit? Sometimes you can ask like this also, how can I help you today? Like that, we can just start with our introduction. Okay. So if it is a known case, like previously I told, we can just ask the interlocutor regarding the name before that role play. And we can just start the introduction like, good morning, Mr. Joseph. I am Saleen Antony, one of the registered nurses working in this community health center. In this situation, we know the patient already. So we'll be just starting like, nice to see you again. Please tell me, how can I help you today? Because how to identify a non-case and unknown case in a community health center, you might be having that question in your mind. So in that case, if the introduction of that role play card, if it is stating that he came after a week to get an information regarding the injection procedure, like subcutaneous injection procedure. Already the patient has visited you, and now he came for a revisit. Like that, there is a setting that it is a known case. Or day before yesterday, the patient came for seeing you to ask regarding some procedure. Today he came for that procedure. So you know that case. So it is a non-case. Likewise, we can identify it as a non-case or unknown case. In a hospital setting, I already told you regarding the hospital setting, whatever the case might be, we can just start like an unknown case. We need not to do like a non-case. Or if we forget to ask the name of the patient before the role play, we can just start like an unknown case in a hospital setting. Okay. So I hope you understood regarding this, how to introduce in a community health setting or in an OPD or in a clinic. All the settings we can go through like this only, but just change the setting. Like, so if it is if it is in an OPD session, you can just change the setting. Like, I am Celine Antony, one of the registered nurses working this in working in this OPD or in this clinic, like that you can just tell. You can just change the wordings, or you can just there is no stipulated way, there is no strict way that you have to follow like this, or you have to use the same sentence. There is not a it is not mandatory for all the settings. You can use your own sentence, you can use your own phrases to start with the introduction, but the content should be like this. It is better to please the if you're going through this way, it is better to go into that track, and also we can just make a confidence from the interlocutor that we know the settings and we know a proper way to start the introduction. So better to go with, like this, but you can use your own sentence and you can use your own phrases. And if it is a home visit, it is a total different scenario. You have to go through in a different approach, because we are going to meet the patient in a home, or we are going to meet the patient in a home through a home visit. So in that setting, we have to greet like, we have to start the introduction like, first for every setting we will be just greeting. So good morning, and we'll be introducing ourselves like, I'm Saleen Antony, one of the registered nurses working in this community health center, like that you can ask, or a community health nurse working in your locality. Here we have to ask whether we are talking to the right person. So we have to just ask like, am I talking to Mr. Joseph? So the patient might be telling that, yes, I'm Joseph. So we can tell like that. So I'm in the right place talking to the right person. We have to just confirm, and we have to tell that we are glad that we are at the right place, and we are talking to the right person. We have to just confirm that one, and tell the purpose of your visit, as per the your role play card. Sometimes in the role play card, the setting will be like, we are coming to a patient's house to just give an education regarding self-administration of insulin, self-administration of any injection as per the doctor's order. So we have to just tell like, I'm here to give an education, or I'm here to introduce you to how to do a self-administration of injection as per your GP's instruction. Like that we can just start. Okay. And we can just ask whether is it the right time to talk with that patient. We have to just confirm that one. Sometimes if we are getting an aggressive patient, we are starting with the introduction. Sometimes the interlocutor might tell that this is not the right time, and I'm busy with the right now, so can you come after some time. It will not happen in a real setting, but sometimes if it is an aggressive patient, we can get some reply like this. So better to always start with asking permission for the patient, whether this is the right time to talk with that patient. So always ask like, is this the right time to talk with you? Then proceed to the task. So this is the different way of introducing in the role play card, that is in the hospital, that's in the home visit. So next is the recovery room. Recovery room, you might be knowing that the patient just underwent the surgery and he's in the recovery room, and we are going to meet with the patient, and we are going to ask something related to pain, or something related to relieving the anxiety of the patient, or sometimes we are dealing with the concerns which a patient is having. So in that setting, we have to introduce in a different way. Like we will be greeting like, good morning, and introducing ourselves like we are one of the registered nurses working in this recovery room. And in that situation, we can directly ask, please tell me your name. In that situation, we'll be uh, thinking that the patient might be in a sedation, or might be recovering from the sedation, or he might be in some pain or something. So we'll be asking the patient that we are just empathizing. We are asking like, are you able to tell your name? And we'll be just introducing the patient to that setting that, all right, Mr. Joseph, you just underwent a surgery a few hours ago and the surgery went well. You are in the observation now. How are you feeling now? Like that, we can just introduce, and then we can proceed to the task. So I hope you have understood all the settings and how to introduce in different settings. It's a small topic. I just told how to just introduce. In the task, we'll be using different type of technique. Later on sessions, we can discuss regarding all those things. So this is the discussion time. I hope you understood